A study on pain in the middle upper arm caused by frozen shoulder and shoulder joint injury. Many patients who have injured the shoulder joint complain of pain extending to the outer central part of the upper arm as a chief complaint. If I observe the area around the acromion with an ultrasound observation device in a patient who has injured the shoulder joint and has pain in the middle of the upper arm, we hypothesized that we could observe the acromion injury, which is the insertion point of the deltoid muscle, and performed echo observation. I will introduce 4 cases and report what I added considerations. Case 4. Damage can be seen at the attachment of the deltoid muscle of the acromion. Case 5. 64-year-old male. He had swelling, spontaneous pain, and pain on movement in his right shoulder joint, and pain in his mid-humerus. Damage is seen at the attachment of the deltoid muscle of the acromion. A hypoechoic image can be observed in the upper acromion, which is supraacromial bursitis. An irregular image of the greater tubercle can be confirmed at the insertion of the supraspinatus muscle. Case 6. 73-year-old female. She had pain in her shoulder joint and mid-upper arm. A hyperechoic image can be observed in the periosteum and the surrounding area above the acromion, and damage can be observed. Damage to the deltoid muscle, subacromial bursitis, and an irregular image of the bone surface of the greater tubercle, which is the attachment of the supraspinatus muscle, can be observed. This part may also be supraacromial bursitis. Case 7. 78-year-old female. She had pain in her shoulder joint and pain in her mid-upper arm. An irregular image was confirmed on the acromion bone surface, which is considered to have been damaged by the traction of the deltoid muscle. A hypoechoic image can be confirmed in the upper acromion, which is considered to be supraacromial bursitis. Greater tuberosity injury at the supraspinatus insertion can be observed. In the four cases, in case 4.5.6.7, we were able to confirm the acromion, which is the insertion part of the deltoid muscle, and the damage around it. Supraacromial bursitis was observed in case 4.5.7. There is a supraacromial bursa between the acromion and the skin, and inflammatory symptoms may sometimes persist for a long time due to trauma. This is thought to be caused by damage to the attachment of the deltoid muscle in the upper acromion, resulting in inflammation in the supraacromial bursa. I hypothesized that a patient with a shoulder joint injury who had pain extending to the outer central part of the upper arm would be able to confirm the damage by observing the area around the acromion with an ultrasound observation device and performed echo observation. As a result, damage to the attachment of the deltoid muscle at the acromion was observed. After that, similar acromion injuries were observed in many cases. There are many cases with deltoid injury and rotator cuff injuries, such as supraspinatus and subscapularis. And when treatment is performed, the pain in the outer central part of the upper arm disappears quickly, and in many cases the pain in the shoulder joint remains. Discussion on deltoid muscle injury originating from the acromion. I believe that most of the pain in the outer middle part of the upper arm is caused by acromion injury, which is the insertion point of the deltoid muscle. It is thought that the pain occurred in the entire deltoid muscle due to damage to a part of the deltoid muscle. The deltoid originated anteriorly in the lateral third of the clavicle, medially in the acromion, and posteriorly in the spine of the scapula and stops in the medial lateral deltoid tubercle. There are three origins of the deltoid muscle, but the acromion attachment is the most likely to be damaged. The internal and external rotation of the shoulder joint can be coordinated and substituted by the thoracolumbar joint and hip joint. Considering that the movement of the shoulder joint abduction cannot be effectively covered by other joints, I think it is understandable. Thank you for your attention.